Quebec will roll out a COVID vaccination campaign this fall, but this year, not everyone will get it for free. Quebec Health says the federal government is no longer offering the vaccine to the provinces for free. However, Quebec says it will continue to offer the vaccine at no charge for people who are considered high risk. That includes those who are over the age of 65 or people with compromised immune systems. The rest of the population will have to pay somewhere between $150 to $180.
With the expertise that we've developed during the last few years, and then especially for the people that are at risk and the others that are not, we had the consideration of the Community of Immunization of Quebec, which is led by Dr. Caroline Quach, who's going to replace me in a few days. So with that in mind, we considered that it's not a great advantage to be vaccinated if you're not in group that are at risk.
Dr. Brosseau says vulnerable young people like those with diabetes or chronic illness or pregnant women will continue to be vaccinated for free. I want to bring in Dr. Christopher Labos now. He's an epidemiologist and cardiologist. Hello to you. Thanks so much for being with us on this. So it sounds like Quebec is following Alberta in no longer offering province-wide COVID-19 vaccinations, except for those high-risk groups as well as healthcare workers. Your reaction?
I don't know that this is the greatest idea. I understand the rationale that they're putting into it. They're saying we're trying to use our limited healthcare resources in the most efficient way possible. So let's go out and target these higher risk groups. I understand that logic in theory. My worry is that in practice, a lot of people are going to hear this and say, oh, I don't need to get vaccinated anymore. And I can tell you right now for free, nobody's going to be paying $150 for a COVID vaccine. I mean, the price point on that is frankly prohibitive for most people. It's really a question of whether we want to look at this from an ideal, very technocratic perspective, how do we maximize our efficiency, or whether we think a simpler message would be more effective. And if there's one thing we've learned from the pandemic is that sometimes simple messaging is more effective. I think we would have been better served by just telling people, hey, come get your COVID and flu shots in the fall in one appointment to maximize efficiency. And quite frankly, most low-risk people probably would not have bothered, but at least you would have had a simpler message that would have caught everybody, because now everybody's going to say, wait, am I at high risk? If I have diabetes, does that make me at high risk? And if everybody had a family doctor, well, then maybe we could have resolved this easily. But when you have a situation where most people don't have a family doctor, it's going to be very hard to triage who gets the vaccine and who doesn't.
And what could be the effect on the overall population if fewer people are having a COVID shot?
Well, it's going to make COVID worse. The question becomes how much worse. I think the government's modeling suggests that it's not going to be that bad. It really becomes a definition of what you think that bad means. If your question is, am I going to die of COVID? Well, if you're under the age of 65 and you have no other medical problems, you probably are not going to die of COVID, especially if you've had COVID before and survived it without any complications. But there's still a large section of the population that is at risk. And of course, even if you're young and healthy, you could still get quite sick from COVID. You could be off work for several days, if not weeks. There are still people getting long COVID, even though we tend not to talk about it that much anymore. There are implications to this that go beyond the simple metrics of death and hospitalization. And again, I understand if you're running a healthcare system, that's what you're focusing on as a metric that is relevant to you as a systems administrator. But there's a lot of things to an individual that's going to matter. Like you getting sick for a week is not in your best interest either. So there's a lot of subtlety to this. And when you make the messaging too complicated, I think a lot of people are just going to check out mentally and say, oh, okay, I don't have to get vaccinated against COVID anymore because COVID is over. And, it obviously isn't.
Yeah. We should also mention the flu vaccine will continue to be covered. But was this, doctor, an issue of waste? Were a lot of the shots just not being used?
I mean, there was some of that. There were some doses that were not being used. There was some inefficiency of the system. And again, if you're trying to minimize cost, and, I'll be very honest with you, I was kind of shocked when I saw the price point of $100 per vaccine, because during the pandemic, although we never actually saw the deals that were made with the companies, we were told that the price point was somewhere between $20 and $30. So there's obviously a differentiation that has to happen about whether you're getting the vaccines for $20 or whether you're getting them for $100. That's going to change how you address the situation. So there's a lot of factors that go into it, and a lot of these probably are economic and efficiency and administrative issues. It's a question of, do we want to make decisions based on administrative issues, or do we want to make decisions based on medical issues? And of course, I realize we live in the real world and we have to make compromises, but it would be nicer if for fundamental things like vaccination, especially in the current climate where there's a lot of misinformation about vaccination, if we had a simpler, more consistent message, which is come get your 2 doses, COVID and influenza at the same time, at the same appointment, that would have been, I think, a cleaner messaging that would have been easier for people to understand. As it is, if you're at high risk and you're eligible, you should still go out and get vaccinated. That is very clearly going to be beneficial.
Dr. Christopher Labos is an epidemiologist and cardiologist. Thank you so much for being with us today. Important subject.